Today we're going to be working with a client that presents carpal tunnel syndrome, just to demonstrate how massage therapy can be effective with that particular dysfunction. Okay, how are you?
Good, how are you?
I'm fine, thanks. Okay, let me just take a look at what's going on. So carpal tunnel. Okay. And typically, working with carpal tunnel, it's really about a nerve that runs from the forearm down through the wrist. So we're not going to be working with the nerve at all, but we're going to be working with all the channels that nerve runs through. So it's working with the muscles on the top that may very well tighten and pull on that nerve, as well as where it runs through the wrist. So we'll be working on the lower part of your wrist. There's a little band of ligament that runs across here, and that little carpal tunnel really is just a tunnel. It's where the nerve runs through. So we'll be trying to loosen this up. We'll be trying to loosen the top up, and it's really just trying to create more space in this band that goes around your wrist here. So we'll see if we can help that today. So we're going to work all the way up to the elbow, just as it crosses the top of the elbow and all those muscles. And it's surprising, Tara, how many issues in the wrist and the arms start because of those nerves that run down from the back, from the spine, all the way through all this area here. So we're going to work all the way up to your shoulder and feel that little piece of muscle in the middle. That's one of the ones that it's like the space in between your ribs. It doesn't get a lot of movement. All it does is really turns the arm sideways. So it also doesn't get a lot of lengthening and smoothing out. So being able to let that relax and let go really gives you a lot of space. And that's really what we're trying to create. Sometimes those tendons can stick to it. So we want to just go through and loosen up and make sure that it's not restricting anything at all. So, but everything is so close to the surface right here that we want to not pinch you or roll anything in the wrong direction, or that really causes some pain. So by stretching everything out, we're able to really feel what goes on under there. Work that retinaculum. It's called a retinaculum, or a little bracelet underneath there. And these bones are tiny, so we can be very careful as we work here. But again, this band that goes across here, not only is the retinaculum, or that little bracelet, goes straight across there, but then also a very large tendon comes down, and it's almost like a sheath. It's almost like a flat piece.